Hi, my name is Lauren.
Hi, Lauren. I'm Lindsay. Nice to meet you.
Nice to meet you. Can you give me some information on this client here?
Sure. I was just about to go into room 619 here in a couple of minutes with Mr. Glenn Light. So I'll tell you a little bit about Mr. Light. He was admitted to the ER for an increased blood glucose level and a non-healing wound for the last 3 weeks. He's also had complaints of bilateral tingling in his lower extremities for the last 3 months. He is being seen by Dr. Phillips. He has no known allergies. He is a type 1 diabetic with diabetes mellitus. He has a stage 2 diabetic ulcer on his right heel. It's about 5.5 by 2.5 centimeters and 3 centimeters deep. It's been draining serosanguinous drainage. He is on a diabetic diet with sodium restriction. Now, Mr. Light, when we went in to inspect him earlier, he was alert and oriented ×3. He does wear glasses. His lungs were clear on auscultation. He had no abnormal heart sounds. His abdomen was soft and non-painful. He is up as tolerated. He does have an IV in his right forearm, but he is not receiving any fluids. Now, his lab work was pretty normal. His A1C was a 6.5, which is indicative of good diabetic control. His glucose when he came in was elevated. It was at 310. And his calcium was low at 7.4. Also, his red blood cells were a little low, his hematocrit was a little low, and his ALT was slightly elevated. Basically, we're going to be going in to see Mr. Light and give him his Lispro based on the sliding scale that the doctor has provided.
Awesome. Why specifically is this client receiving the medication, and what action does the medication have on the body?
Well, because Mr. Light is a type 1 diabetic, that means that his pancreas does not produce any insulin on its own. So we have to give him a source of insulin so his cells can uptake the glucose and utilize them for energy. You can think of insulin like a lock that fits into the door to open it up so the cells can take in glucose.
Awesome. When should you question administering this medication?
Well, you want to question this medication if his blood glucose levels are normal. A normal range is around 70 to 120. If it's lower than that, you would also question giving the medication. And also based on the doctor's sliding scale, he puts in there if it's below a certain level to withhold the medication and to give him a call.
All right. And does the medication have a therapeutic serum level?
It doesn't have a therapeutic serum level, but we do want to make sure we're doing the AccuCheck and checking his blood glucose before we administer the insulin. The doctor may also order another A1C so we can make sure he's been under good diabetic control over the last 3 months.
Okay. And which vital signs must be monitored?
Really, for Mr. Light, we're going to monitor all the vital signs because any deviation from normal could be a sign of hypoglycemia. We also want to make sure we're doing daily weights to make sure he's not retaining any fluid.
All right. And which physiological parameters should be monitored when the medication is being administered?
Well, we want to monitor, like I said, his blood glucose before administration, but we also want to monitor him for signs of hypoglycemia. So that could include anxiety, shakiness, heart palpitations, confusion. Also, if he's really sweaty, that could be a sign of hypoglycemia.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
Well, to make sure that he's administering this medication safely, we want to make sure he's aware of the signs of hypoglycemia so he can alert us in the hospital, and also so he knows at home when he shouldn't give insulin or when he should alert medical professionals. We also want to teach him how to draw up the proper dose because Mr. Light does wear glasses. We want to make sure that he can see the numbers on the syringe, that he can draw it up properly. We want to make sure that he knows how to store his insulin properly, that he knows when to discard the insulin when it's no longer any good. We also want to make sure he's using a fresh needle every time he draws up his insulin. And we also want to make sure that he washes his hands and he alternates where he's giving the insulin to prevent lipodystrophy.
Okay. And what are the side effects and potential adverse reactions?
Well, hypoglycemia is the one that we worry about most. He may also have a little swelling or redness at the injection site, and in rare instances, anaphylaxis has been an adverse reaction of insulin.
Okay, and how will you know the medication is effective?
When Mr. Light's blood glucose levels lower back to a normal range, we know that the medication is effective.
Okay, can I watch you administer the medication?
Yes, of course.
Okay.
So if you want to follow me to the Pyxis over here,
Okay.
I will draw up the medication. So I'm going to wash my hands here. And I'm going to pull the medication out of the anti-diabetic drawer. So based on the MAR here, Mr. Light is getting Lispro, also known as Humalog. All right, so I've got Lispro here. It is in date. It is not expired. And I'm going to go ahead and get a syringe and get an alcohol swab. So I'm going to swab the top of my vial here. And I'm going to open up my insulin syringe. And I'm going to pull up 6 units of air. Now, have you given insulin in class before?
Yes.
So this is a good review for you. So I've drawn
Yes.
up the 6 units of air. So I'm going to insert my needle, inject the air. And then as I'm drawing it up to 6 units, I'm also going to verify that I do in fact have Lispro in my hand. And Lispro is what's on the MAR. And I'm going to go ahead and do my one-handed capping technique. And I'm going to take this sticker here, Lispro. And if you want to verify there that how many units I have drawn up.
6 units.
Excellent. So his blood glucose, if you look at the sliding scale, was 290, which is why we drew up the 6 units.
Oh, okay.
Sorry, I sometimes do this stuff without explaining it properly. And then we're going to go into Mr. Light's room now, okay?
Okay.
Hello there, Mr. Light. I'm Lindsay. I'm your nurse. And I've actually got a student nurse with me today who's going to be following and observing, if that's okay with you, Mr. Light.
I guess.
All right. So let me wash my hands here. And when my student comes in the room, I'm just going to close the curtain to provide us with a little bit of privacy. We're going to be giving you your Lispro injection today. Okay, Mr. Light. So I know you've been on this medication for a while, but just because we have a student here, would you mind going over some of the signs and symptoms of hypoglycemia that you know you need to alert us if you're experiencing any of them? Okay, Mr. Light, while you're thinking about the signs and symptoms of hypoglycemia, I'm just
Sorry. I
It's
kind of
okay.
dozed off there for a minute.
It's okay. Sleep is a commodity in the hospital, I understand.
So I guess if I'm like sweaty and headache or dizzy, then maybe my blood sugar fell too low.
You got it, Mr. Light. Now, Mr. Light, I know that I've met you before, but I just need to verify your name and date of birth.
Glen Light,
And your date of birth?
2/2/48.
You got it, Mr. Light. Okay. Now, Mr. Light, your breakfast is going to be here in about 15 minutes, so I'm going to go ahead and give you your insulin injection, and I'm going and confirming this against the MAR again, so my student is just knowing what I'm doing here. So, Mr. Light, your blood glucose was 290 today, so we're going to be giving you 6 units of the Lispro. Is that okay with you?
Sure.
All right. Now, where would you like to receive this medication, Mr. Light?
My belly. Wherever.
Okay. Well, I looked at the MAR here and I saw that the last two places that we gave it were both in your left side, the lower quadrant and then the upper quadrant. So I'm going to go ahead and give it on the right quadrant in the upper side if that's okay with you.
Okay.
All right. So I'm just going to put on my gloves here. Now, Mr. Light, have you had any difficulties doing this at home on your own?
Not really.
Okay.
I just have a hard time seeing. I wear glasses.
Yes, I know. Your glasses are sitting there on the bedside table. I'll make sure I get those for you before you leave. Do you have your wife at home who can maybe help verify the units when you draw them up just to make sure we're giving you a safe dose?
Yeah, she's just not always home.
Okay. Well, make sure you're wearing your glasses because we want to make sure we're giving you the proper amount. Now, Mr. Light, I'm just going to fold down the blanket and I'm going to raise the bed here. If I can figure out which button does it. You know, they're all a little different. All right, I'm just going to expose your belly here. Just a little bit, just so I can swab the right upper quadrant here. Now, my student, you can see everything that I'm doing here?
Yeah.
Okay. So I've scanned his wristband, I've scanned the medication, I have 6 units of Lispro that I'm going to be giving him now at 1700 hours. So I'm just going to remove the cap, pinch a little bit of skin, give it at a 90-degree angle, and immediately dispose of my syringe in the sharps container. All right, Mr. Light, let me wash my hands here, and I'm going to lower the bed for you. That wasn't too bad, was it, sir?
Not so bad. I'm used to it.
Okay. Now, your food tray is going to be here very soon. It should be here within the next 15 minutes. Now, if you were at home and you were giving your insulin, but you didn't have a meal ready in 15 minutes, what would you want to do to make sure you don't go into a hypoglycemic episode? Have we gone over that with you yet?
I think they told me like 15-gram carbohydrate. Just something to fill my stomach.
You got it. So you want a good carbohydrate snack. About 15 grams is exactly right. You know, so like a granola bar or something, just to make sure that we don't put you into a hypoglycemic episode until you get your meal. So I went ahead and got this little handout for you. I know you've been a diabetic for a while, but there might be stuff in here that you didn't know. It's about diabetes and you. Just goes over kind of everything about being a diabetic and kind of how to monitor your blood glucose levels at home and what to look out for and the importance of diet and exercise. So let me put your call light back here. Now, Mr. Light, was there anything else that I can get for you? Let me get your glasses because I said I would.
Oh, that's good. Thank you.
Okay, Mr. Light. So before I leave, if the student wants to come here, you can see where I scanned his wristband. I scanned his medication. The time is 1700 hours. And I gave 6 units in the right upper abdominal quadrant. And I'm going to just put my initials down here at the end and save that. Okay. All right, Mr. Light. I'll come back and check on you in 15 minutes to make sure you got your food tray, okay? Let me open the curtain here. All right, so there we had it. We gave Mr. Light his Lispro injection. Did you have any questions for me?
Yeah, just a couple more questions.
Okay, not a problem.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, so before I gave the patient the information, I reviewed my 5 rights. I wanted to make sure it was the right patient, the right medication, the right dose, the right route. I also want to make sure that I provided the right documentation at the end and made sure I gave it at the right time.
Okay, and did this information affect your decision to administer the medication?
Well, because his blood glucose level was 290, I went ahead and gave it based on the doctor's sliding scales. I verified where he received it last to make sure that I gave it in a different site to prevent lipodystrophy.
Okay, and did the information affect how you administered the medication?
Yep, because he got his last injections in the left-hand side, I went ahead and gave it in the right-hand side to alternate sites.
Okay, awesome. That was really informative. Thank you.
Not a problem. So we will check back on Mr. Light in 15 minutes if you want to come back with me.
Okay, thank you.
You're welcome.